Hi, everybody, and welcome to this week's What's Up Wednesday interview series. If you're new here, we meet with guests of our network and share resources and feedback out to our industry. Today, we have Lisa Thiessen with us, who's a physical therapist at St. Mary's and also SCL Health. She's going to be covering all things toe walking in children with us today. So, hey, Lisa, thanks for being here and welcome.
Thank you. Thanks for having me.
All right. So, to kick us off today, just to briefly explain your role and how long you've been with St. Mary's and SCL Health.
Great. I'm a physical therapist. I have been working for SCL Health and St. Mary's for 24 years, most of that in pediatrics, a couple of years in just regular patient care, and then moved on to treating children.
Amazing. Okay, good deal. That's a good chunk of time already. Yeah. So congrats on that. So it may seem self-explanatory, but for those who may be unaware or not really sure what it means, what is toe walking and kind of how does that initially occur for children?
Right. As children learn to walk, we see a period of time where they'll play around up on their toes or they'll have their feet flat. But really what we want a child to be walking with their feet on the ground, being their heels on the ground by the time they're 2 years old. If they're not, if we see them up on their toes, we consider this toe walking. It doesn't have to be all the time. They can be up on their toes perhaps 60% of the time. Some kids are up all the time. And then when they stand, they might stand flat-footed, but it's still considered toe walking if they're walking primarily up on their toes.
Gotcha. So does that start kind of at birth, or kind of what have you seen for kind of how that happens to begin with?
You know, most of the times what we see is a parent will tell us, oh yeah, they've been toe walking since they've been walking. So most toe walkers will start from the time they are toe walking. It's not typical for a child to walk normally and then at age 5 get up on their toes. It almost always, when we really start digging deep, happens when they learn to walk.
Okay. Fairly early on then. Yeah. So initially there.
Usually about a year old. Mm-hmm.
So why is it necessary to change how that children walks, if that is the case? Kind of what are some preliminary steps and why does that need to happen?
Well, and that's a really great topic because a lot of times what a family will hear is, oh, they'll grow out of it, or it's no big deal, or how cute, they should be a ballerina. We hear all that. But what the problem is the foot is designed to take weight on your heel. And if most of us think about our heel, it's really gnarly. It's thick and it's coarse and it's really tough. And because it's taking all of our body weight every single step. So when we change that and it goes onto the toe in the front of the foot, like the ball of your foot, is not designed to take that kind of pounding. And so we don't worry about the kids at age 5, 6, 7. I worry about what they'll be like at age 30 and 40. And will they be able to stand at their job if it's a standing job, or go on a hike with their family without being painful?
Sure. Yeah, that's a very good point. So kind of what are some best practices to address this early on and treat this kind of as the signs are shown?
Well, there's a couple things we think about with toe walking and what we look at. The first thing we look at is, does the child have enough motion in the heel cord or the Achilles tendon to get the heel on the floor?
Sure.
If they've been toe walking a long time, this may be very tight. They may be so tight that they actually can't comfortably get the heel on the floor for every step. If we think about how long we have in our steps, it's a nanosecond to get that heel down. No one has time to go, oh, I think I'll stretch my heel down every So the big deal is, the first thing we look at, does the child have enough range of motion or movement in the heel to get the heel down? If they don't, then we will address that. We'll address that with stretching, night stretching. We do something called serial casting, where we actually put them in casts that are gently stretching them a week at a time, and we'll change those. So it's really important that they have enough range of motion to even get the heel down. Now, if they do, if we look at their foot and go, oh yeah, they've got plenty of motion, it's just a habit that they're toe walking, then that's what we've got to change. Now, children take about 10,000 steps a day. So if you're mom or dad and you're nagging your child to get down on their heels, you're going to catch about 100 to 200 steps. So those 9,800 other steps are not being addressed. So we almost always will recommend a brace, or we call it an AFO, to get the child down on their heel and do some, we call gait training. So we're using the brace essentially as a training tool.
Sure.
Instead of us nagging the child to get down on their heel, which really just doesn't work. So if you're doing that, give it up.
Let you know now.
I'll let you know it's not going to work.
So do most people end up having to go to physical therapy, or are there kind of like at-home remedies or things that they can look up to do on their own without having to outsource some help?
Yes, I think that's an interesting question, because if your child is toe walking and you have cued them enough and said, "Hey, walk on your toes, do that," then it's probably not severe enough where we need to address it in the clinic. If you have seen it over year after year and have asked the doctor, and the doctor may have said, let's watch it, it probably won't resolve on its own. So it is important to get to your doctor or your physical therapist so they can help you get some strategies to get the child back down on their heels.
Okay, perfect. So kind of how long would you say, ballpark wise, how long does it take to break this habit once kind of the issue's been addressed and kind of next steps are in place for that?
Well, it's really interesting. One of the things we think about in physical therapy for children, we see a lot of different diagnoses. And toe walking is honestly one of our toughest. If you think about how long a child's been toe walking, perhaps maybe we get a 6-year-old, they've been walking on their toes for 5 years. So we're having to take a habit that's 5 years old that the child could care less about. They do not care how they walk, and change that. So almost always it takes way longer than we think. And I, through the years, have really started figuring out it takes almost a year of practice and training and figuring out with the AFO, going full-time with AFO, then going part-time, taking them out of it, seeing if they're ready. Maybe they're not ready. They go back into the AFO. So my gut is that the older they are, the longer it's going to take. And we almost always give it a year.
Okay.
One of the big things I think about is that we like to get our little toe walkers as early as we can. And the big reason for that is that they aren't self-conscious about wearing a little brace to school. Once you get a middle school age child, they aren't really that interested in wearing something that looks different from the other kids.
Right.
Now, at age 4 and 5, they just think it's cool. They got to pick out a pattern. So it's really important that we try to get this before it becomes a cosmetic issue also for the kids.
For their life. Yeah, that's a very good point. Yeah, because once they get older, they start to care what they look like. So
we want to respect that. And I get it. It's hard to wear a brace every day. And we're really good about moving around swimming lessons and soccer. And we want the kids to be doing typical things.
Right.
So we don't want to interfere with their lifestyle. But at the same time, we want to think about the health and the structure of that foot for when they're 30 and 40 years old.
Later in life. Right. Exactly. So if people want to learn more, kind of want to look for some resources on this, where can they go to? Do you have any websites for resources or ask questions? Where can they go to for that?
You know, it's so tough. If you're looking on the internet and you look up toe walking, you will get the spectrum. You'll get someone wanting to cut the tendon right away. You'll get someone saying, don't do anything. So the research on the internet is all over the board. I would really suggest, really talking to your local, your pediatrician or your family practice doctor and say, hey, this hasn't resolved. This is still a concern. How can I get to someone who can at least give me some strategies or look at this? And typically they're going to refer you to the orthopedic surgeon or the physical therapist. Okay. The orthopedic surgeon's not going to do surgery right away. They're at least just going to look at the foot and see if the structures are good and then probably refer you on to physical therapy. If you're in an area where you don't have a lot of pediatric physical therapy, it may be kind of tough, because if you're in the adult physical therapy world, this isn't something you see every day. So my recommendation would be try to get to a town that has, a pediatric therapist who's looked at this before.
Got it. Okay.
Not their first go round with it.
Sure. So that they can kind of consider next steps and guide you from there. Yeah, that's a great point.
Absolutely. Once we see the kids, even if we're casting or wearing the braces, it's scarier to think about the intervention than to actually do it. The kids kind of enjoy it after a while, and they get used to it. It really is not that big a deal. Sure. But undergoing the decision making around it can be very apprehensive for a parent.
For the parent guardian, right? Exactly. Mm-hmm. That's a good point too. Yeah. All right. Well, that's about all I have. I'll leave it up to you for any kind of final thoughts or suggestions. If you have a billboard slogan or anything you'd like to share for our ECE network, feel free.
Our biggest deal is if you have a toe walker or know someone, tell them to get seen early. The earlier we do it, the better. And it's really just going to benefit the child later on.
Okay. Perfect. Yeah, that's some great resources. I appreciate your time today. We can always be in touch going forward if we want to do any follow-ups or anything like that. But that's all, Lisa. I appreciate it. Bye, everybody. We'll see you next week. Have a good one.